Hello friends, Assalamu alaikum. Today we will discuss a topic from the clinical pharmacy. The name of the topic is stroke management. What is stroke? A stroke occurs when blood flow to the brain is reduced or interrupted by a blocked or burst blood vessels. So, stroke is a medical emergency condition. It occurs when blood flow to the brain is reduced. This reduction of the blood flow is maybe due to the blockage of the blood vessels or maybe due to the bursting of the blood vessel in the brain. So this reduction of the blood due to the deficiency of oxygen and nutrient supply to the brain, and thus the brain cell begin to die. When the blood supply to the part of the brain is suddenly interrupted or when a blood vessel in the brain bursts, so this is called stroke according to National Institute of Neurological Disorder. Stroke is a medical emergency and early action can reduce brain damage and other complications. CT scan is urgently needed to find out whether it is hemorrhagic or ischemic stroke. So before going to start the treatment, we must know that whether the stroke is hemorrhagic or ischemic stroke. So for that purpose we do CT scan. So CT scan differentiate as whether the stroke is hemorrhagic or ischemic. So types of the stroke, there are two main types of the stroke. One is primary ischemic stroke and the second one is primary hemorrhagic stroke. Primary ischemic stroke is further classified into two types. One is thrombotic and the second one is embolic. Primary hemorrhagic stroke is classified into two types. One is intracerebral hemorrhage and the second one is subarachnoid hemorrhage. So what is primary ischemic stroke? Primary ischemic stroke occur when blood flow to the brain is reduced due to the blocked blood vessel, and this blockage of the blood vessel may be due to the clot formation. As you can see in this picture, this is the clot showing the blockage of the blood vessel, and this blockage lead to the deficiency of the blood flow. So due to that deficiency, the brain cell begin to die, and this black area shows us death of the brain cell. This is the CT scan report of the patient, and this CT scan report show us that the person is suffering from ischemic stroke because this black area show us ischemic stroke. Primary ischemic stroke is further classified into two types. One is thrombotic and the second one is embolic. So thrombotic ischemic stroke occur when there is a blood clot in the arteries supplying blood to the brain, and in embolic case there is clot formation in the other part of the body, like in the heart or in the arteries of the upper chest, and this clot move through bloodstream to the brain. Symptoms of the stroke. So symptoms depend upon what portion of the brain is damaged. Suppose if stroke is in the right portion of the brain, so the left side of the body will be affected, and suppose if there is stroke in the left side of the brain, so right side of the body will be affected. So generally seen symptoms in the stroke patient: paralysis, maybe hemiplegia or biplegia. Second one is numbness or weakness in the arm, face, legs, and especially on one side of the body. Third one, trouble in speaking or slurred speech, especially when left side of the brain is involved. Fourth one is confusion. Fifth one is a vision problem, sometimes blur vision or sometimes complete loss of vision. Sixth one, sometimes unconsciousness, most of the cases unconsciousness, and finally death may also occur. Physical investigation. In physical investigation, the first one is facial movement. We will see the facial movement of the patient. We will ask the patient to smile, show your teeth, so we will notice that which side of the face is not move, right or left side. And the second one, we will ask the patient to raise his both arms. If one arm does not rise, so we can decide that which part of the brain is involved in the stroke. So third one is speech. From speech we can also decide whether the stroke is in the left side of the brain or in the right side of the brain. If the person is if the person has disturbed speech, slurred speech, or he is finding difficulty in words, so we can decide that the person is suffering from the stroke on the left side of the brain. So in case of vision problem, we can place a pen in his hand and we can ask from the patient that what is it. From the lab investigation, we can also rule out the stroke like CBC or full blood count. We can also check serum electrolyte. We can also check renal function test, cardiac enzymes like troponin. We can also check clotting or coagulation study or coagulation profile. We can also do ECG. We can also do echocardiogram. We can also do EEG. And so going toward the treatment of the stroke, so first one is ischemic stroke. So in ischemic stroke, the sooner the better. As soon as possible we treat the patient, so the better he will get. Our main target in the ischemic stroke is to resume the blood supply to the affected area. Antiplatelet and anticoagulant agents, we have aspirin. Aspirin is a first line drug in the ischemic stroke. Remember, the person suffering from hemorrhagic stroke will not use aspirin because aspirin will cause further bleeding. Aspirin should be started within 24 hours of the symptoms appear. Clot breaking drugs like we have tissue plasminogen activator. We have also alteplase. These two drugs are the gold standard in ischemic stroke. These drugs dissolve the blood clot and resume the blood supply to the affected area. So treatment of the hemorrhagic stroke, our main aim in the treatment of the hemorrhagic stroke is to control the bleeding and to reduce the pressure in the brain. So we can use such a medicine which reduce the thinning effect of the blood. We can also do transfusion of the blood product, and thus to reduce the blood thinning effect. We can also surgically repair the ruptured blood vessel by two methods. One is a surgical clipping method and the second one is a coiling method. In surgical clipping method, we use a clip and we close the burst part of the blood vessel. So closing the burst part, we can reduce the bleeding. And in the coiling method, we insert a coil and close the rupture part of the blood vessel. So this was all about the stroke management. So please kindly subscribe my channel and like the video. Thanks.